fibromyalgia caused by 3 very severe motor vehicle accidents and some trauma, pretty much being assaulted. What I've discovered, the root cause of fibromyalgia, it's not really an autoimmune disease. What happens typically when you get whiplash, it damages your brain stem, especially right around below the occiput and the suboccipital triangle and the C1-2 meninge, branches of the C1-2 nerve. And so you could see you get suboccipital headaches, you get brain fog because all the cranial nerves are affected. So you can have brain fog, you could have tinnitus, trigeminal neuralgia, non-restorative sleep, anxiety. You have most of these, right?
Yes, I do.
And then pain in all 4 quadrants of the body. You got pain pretty much everywhere. All right. A lot of migraines, right?
A lot of
Non-restorative sleep, you can't sleep at all.
Nope.
Because your fight or flight, your sympathetic nervous system, the switch is turned on when you have the neck trauma. So your reticular activating system is your alarm clock that wakes you up, isn't shut off, you can't sleep. And then your pain sensation, you're oversensitive, it's called allodynia. So that's why when I touch certain areas, you're like very sensitive to pain. Because your brain ultimately is what senses pain. So when the pain highway is overstimulating your upper neck, then it's called the upper motor neuron lesion. It affects your whole body because all the nerves have to pass through your neck. And the brain senses your pain or numbness, and you got numbness in the legs and feet, right?
Yes, I do.
Now check out this reflex, just relax.
Okay.
Look at her whole body. See her whole body shakes? That's an upper motor neuron lesion. So the cortical spinal tract, spinal thalamic tract, which go through your brain stem, again, they're too hyper, if you will. That's why her pain is too sensitive to the pain. So the way we treat this is there's acupuncture point, I think it's gallbladder 20. We inject the stem cell derived exosomes and they decrease the inflammation there, which eventually decreases all the swelling on the tissue. So it'll take the pressure off the nerves and then pretty much all your symptoms are resolved. So watch this fibromyalgia video and you tell me what symptoms you have here. All right.
In my car, and I haven't felt the shooting pain from the sciatic nerve down my leg as much anymore. I can sit down for a long.
That's one of our NFL players. So.
I know when I first came to see Dr. Yu, I was in probably about an 8 for my pain, and right now.
Body. When these points.
Here's the fibromyalgia video right there.
5 even, because I could sit down for a longer period of time without it bothering me as much. So I definitely believe that this laser therapy can work.
Fibromyalgia is a chronic disorder that affects at least 5 million Americans, mostly women. It's characterized by non-restorative sleep and muscle aches and stiffness that may last all day, pain in all 4 quadrants of the body, and the presence of specific tender points. While fibromyalgia pain can vary in intensity, sufferers often describe it as a deep, persistent ache or a stabbing or shooting muscular pain. Other common symptoms include incapacitating fatigue, insomnia, joint pain, leg cramps, headaches, and concentration and memory problems known as fibro fog. Because there is no lab test or x-ray to confirm a diagnosis of fibromyalgia, some patients were once led to believe this pain was all in their heads. Today, many researchers think the brain and spinal cord process pain messages incorrectly, causing fibromyalgia patients to feel pain more intensely. One of the unique aspects of fibromyalgia is the presence of tender points in specific locations on the body. When these points are pressed, people with fibromyalgia feel pain, while people without the syndrome only feel pressure. To be diagnosed with fibromyalgia, a patient must be sensitive in at least 11 of the 18 possible tender points and experience widespread pain in all 4 quadrants of the body.
And you have pain in all those
Yes,
quadrants.
all those
Now
exactly.
check this out. So come follow me here. So I said it's an upper motor neuron lesion, right? In the suboccipital area, the C12 vertebra. So look how her lower neck is about 89.9. And you see her upper neck, look at that, 95.8. That's where the inflammation, that's where he put the exosome-derived stem cells to decrease the inflammation. Fibromyalgia is one of the most hardest conditions to treat because doctors don't know the cause and they don't know how to treat it. I've never had a failed case. I guarantee my work. All our fibromyalgia patients, they've actually got partial or total relief of their symptoms.
Wow.
So we know what to do, okay?
Okay.
And we'll do the after video to show how everything's improving, all right? Thanks for watching. So as I talked about, fibromyalgia is caused by nerve root pressure in the upper meninges of the nerves in your neck or on the suboccipital triangle and the C12 vertebra. So I showed you we detect inflammation in our upper neck, and we double confirm that with infrared thermography. You see that signal? Inflammation in her cervical spine, the upper neck, and you have lower back pain, you know, your hands, and it goes down your legs. And then your lower back has a lot of inflammation there, okay? And then pretty much brain fog, inflammation in your head, and you know, any symptoms down your arms too?
Yes, my the whole arm.
Look at that, it's worse on the right, isn't it?
Yes.
Look at how most worse on the right. Is it numbness, pain, and tingling?
I do get the tingling, yes.
Yeah,
But it's
okay.
numbness too. Yeah.
So now we know what to do. Here's how we track inflammation for fibromyalgia. Now we're gonna treat it with the stem cell derived exosomes, all right?